whole healthcare industry is going to change dramatically in the next couple of years.
To chronic disease management and the preventative aspect of care.
AI can now understand the key clinical concepts of what's being verbalized in healthcare.
Welcome to Leaders in Healthcare. I'm Dr. Jordan Vollrath, physician, entrepreneur, and Chief Medical Officer for Cherry Health. We're talking about all things healthcare. Join us as we speak to innovators, industry leaders, and the people working to drive the healthcare system forward. Today we're talking to Loreen Wales. She's the founder and CEO of MyViva. She's a registered dietitian with a psychology degree who's worked chronic disease for 26 years now. Loreen spent the first 10 years of her career as a dietitian caring for patients at the University Hospital in Edmonton. During this time, she grew a passion for building a practice that focused on prevention after witnessing all the detrimental effects of poor health habits and diets leading to health problems. Loreen started Revive Wellness in September 2006, focusing on empowering people to take charge of their own health. She realized there was a gap in care that existed, preventing patients from being able to manage their health at home, and that technology could help solve this problem, and that's where MyViva was born. So Loreen is on a mission to transform how patient care is delivered, creating more equitable health care for all, while driving efficiency within the clinical setting. She's a member of several boards, is actively engaged in supporting research, and is the only Canadian female healthcare professional leading an ITEA4 International Research and Innovation Project with over 6 countries and 28 partners. Loreen, that's quite the resume. Thank you for joining us today.
Thanks, Jordan, for having me. And when you read that, I just actually sit there and giggle going, is that really what I'm doing? That's I'm just a healthcare professional, right? It's good. I know. It's just kind of funny because you don't often sit and pause and think about all your accomplishments and stuff. So
no, that's awesome. But yeah, no, I'm excited for the conversation today. I myself have finally, you got me ticked over to be a user of the MyViva Plan app. We met a few years ago, I think, at a conference. I'm trying to remember which one is, like Ontario or something.
Yes.
But anyway, it just overlaps so much with what I do in my own practice, dealing with mental health and then weight management. And super excited to dig into it a little bit more, learn more about MyViva, kind of the backstory, and hear a bit more about yourself and sort of the big picture.
Mm-hmm. Well, the journey did start 26, 27 years ago, somewhere in there, when I, as you said, started as a dietitian working in nephrology at the U of A. And I think the most, I had 7 years of university education with a nutrition degree, a psych degree, and that 7 years did not teach me this. I was 2 weeks into my career, and I like to level set and tell this story because it's why I'm doing what I'm doing today. So I was asked to go to a kidney transplant workup class with the healthcare team. And I was told to do 3 things: introduce myself as Loreen, tell them I was the dietitian, ask them what I could help them with. And a gentleman in the audience yelled out that he effing hated me. And a couple other people in the audience said the same thing. Fast forward that to the second month, where the staff said, no, you have to come back. That was the most entertainment that we had last month. And I was mortified. So I thought, well, okay, it surely can't happen again. Same thing happened again. And then I said, okay, well, was this a sick joke? Did you guys put them up to this? And no. And these are strangers, Jordan. Like, I'd never laid eyes on these patients before in my life. And so then I started to think, okay, we must have a problem. But you know what? Twice, it could be some bizarre coincidence. So I fast forward 3 months. The next month I went back and the same thing happened. So 3 months in a row. And I told the nurses, okay, give me all of the phone numbers of all of the patients that have come to all of those classes, and I'm going to phone and interview all of them. And so here was the story. I come see you, Dr. Vollrath, in endocrinology, and you tell me one thing. I go see my cardiologist. They tell me something different. I come see you, idiots, in nephrology, and you tell me something different. Who am I supposed to listen to? Because you're all conflicting one another. Go home, don't listen to any of you because I'm confused. Come back, you all label me non-compliant and then are dismissive of care. So, Loreen, do you think after 20 years of putting up with that you might get to a point where you actually might tell a perfect stranger that you effing hate them? And my reaction was, absolutely. I can appreciate that. And that was the best education I could have ever gotten. And I'm sure you as a physician have probably been told similar stories. Would you not agree in clinic?
Oh yeah, I definitely meet some pissed off patients now and then. That happens quite regularly. Usually I'm able to
Right?
win them over, but not always.
Yeah, and so they're frustrated with the system, right? Especially ones that are living with complex health conditions that have to see multiple different disciplines in multiple different specialty areas. And so it really, I don't know, it really bothered me. And I thought to myself, no, I'm not going to be that person. And so it actually ended up turning me into being a really strong patient advocate and being that one person that they would see within all of these areas that would actually help take all of the information that they were getting from all of the different areas and pull it into one story so that they could actually be confident what they needed to actually do at home. And so that's what I did with the help of colleagues in endocrinology, colleagues in cardiology. I said, teach me and I'll teach you. Right. And so we worked together to do that to help improve patient care. And so fast forward, but there was still massive gaps because within the clinic setting, all I had at my disposal, and I'm sure, well, and today is the same thing, which is all I can give patients to manage their health at home are my verbal recommendations, some general handouts or general websites. That's it.
Which
right?
falls apart pretty quickly when there's no reminder, there's nobody like checking in on things, reiterating the importance of it, right? And like just, I don't know, how often do you read all the papers that you get in the mail and your email? And like it gets overwhelming. I don't blame people.
Right? And it's not, and it isn't because you aren't a good doctor. It isn't because I am not a good dietitian. It's that, like, I mean, we all went as healthcare professionals. We're all incredibly passionate about what it is that we do, right? We went into healthcare for a reason. We all want to make a difference. But then we're put in this ecosystem that limits our time, rightfully so, because it's expensive to spend time with us. But we haven't taken that information that you and I have learned on how the body works and what works to help prevent disease and stuff. And we haven't disseminated it in a way that actually builds self-efficacy, like put it into systems that actually build self-efficacy for patients. We just think that the dissemination is you and I verbally telling them or blurting it out on a piece of paper that they're actually going to learn that. And that to me was the fundamental aha moment that I had going, wait a second, we're not doing it. And I proved with the train wrecks within nephrology that if we use systems to be able to give patients to manage their health at home and got them engaged, we could improve outcomes, proved that. So then fast forward 10 years or another 7 years after I jumped from 10 years of tertiary care into building our living lab, Revive Wellness, did primary care for 7 years, saw the same problems there, and then had the epiphany that, wait a second, technology could actually help us solve this problem. Because you and I have built and memorized many different algorithms to drive efficiency in the clinic setting, right?
Oh, absolutely. That's like half of medicine is just
Right?
where am I on the algorithm?
Exactly. Well, that can be digitalized. So what we realized with lifestyle medicine is, wait a second, there's actually so hence MyViva plan was born, where we decided we could actually solve problems on both sides of the fence. One, as healthcare professionals, to help fill a massive gap for us in the clinic setting. Two, reduce redundancy and to drive efficiency. And then we actually can use the technology to build a system that we actually put in the hands of the patient to get them engaged in managing their health, that they become that partner to you and I. So now you and I within clinic have something that we can hold the patient accountable to sinking their teeth in and engaging in. And along that way, they build self-efficacy and take control of managing their health. So that's
Getting
it
them
in a
to
nutshell.
that point, that's the tricky thing though, right?
Exactly. And that's the hot mess, right? But here's the interesting thing, because what is the other alternative? because you and I just sitting there telling them they need to exercise, they need to eat balanced, they need to manage their stress, they need to sleep better. Like,
it goes so far.
what?
Like, I had a patient a couple weeks ago, and this was like part of the mental health counseling. So this was like a longer format, 90-minute appointment. And the initial intake is just kind of like going through like kind of the quick synopsis of their whole life and their current habits and all these things. And so usually then we come away with that with like I call it the maybe pile of like different things that might be relevant or interesting. And then later on at different appointments, we'll follow up on these individual items. But so on visit 2, this one patient was like, yeah, I quit smoking weed. I'm exercising regularly and like really enforcing a lot of these boundaries with my mom or my sister or whoever it was. She's like, I'm feeling great. I was like, just like shocked. Like, this never happens where people just like immediately go and turn around and do all these like kind of life-changing things. It was very like a, not typical experience. It's usually okay, like how do we start getting buy-in and actually garnering interest in these different individual pieces? And one of the other things that's become kind of like interesting is just like shifting from the very quick, like 15-minute appointment schedule to these longer format 90-minute appointments. Like sometimes like the biggest, most positively impactful things for some of these patients has just been like, I've spent an hour and a half talking to them about the thing that they had already been prescribed. Like, oh yeah, I've got the prescription. I haven't taken the meds. I just kind of lost interest on it. Or like, yeah, I know I'm supposed to be doing this specific thing or that specific thing, but just like having the time to actually, part of it's education, part of it's, explaining the why and the rationale behind it, and sort of like, all the pot of gold at the end of the rainbow. But so that's really why I found the MyViva tool so interesting, was it's just like a direct mechanism to help start getting across that initial hurdle of getting started on these different things and following up on these different things, and enabling the patient to like keep track of their various goals and all these pieces that, often just kind of like, scratch the surface and then fly by, and then they're kind of just gone again until somebody else brings it up at another future appointment, which could be years down the road, right?
Right. Well, so, I mean, you just described the hot mess, right? I mean, how many times in clinic do you see patients come in and you ask them how they're doing, and they say to you, gosh, Jordan, I'm feeling completely overwhelmed. My head's in the clouds. I'm not sure what end is up. I'm feeling like really like overwhelmed with everything. What are you and I? It doesn't matter if you and I have 10 minutes, 60 minutes, 90 minutes. How are you and I supposed to really get to the root? I mean, sure, more time, you get to dig into more, but you're playing detective for a really long time. It can take 1 to 2 to 3 to 4 appointments of playing detective before you ever really peel all of the layers off of the onion to figure out really what's going on, right?
It's often multifaceted, yeah.
Exactly. And so the interesting thing of what you've described with MyViva plan, what we've wanted to do is to help get to that, like help give the patient a framework and a system to be able to dig in and do their own initial assessment on the program, where they're thinking about, so they do a mental health assessment. They think about, well, what health outcomes are they wanting to achieve? Because, I mean, they can come in and see you and I, and their blood pressure is through the roof. Their cholesterol and LDL are high. Their blood sugar is out of whack. And you and I know what they need to do. Doesn't mean we can convince them. And if they're not in the right frame of mind or at the willing to engage and ready to change behavior, it's falling on deaf ears, right? And so, but how do we get there? Because that doesn't leave you and I off the hook of saying, okay, we wash our hands, nothing we can do until they come back and they're ready to change behavior. Well, and that's where you and I lack the systems to be able to help them guide them through that. And so our initial assessment, that's what we get them to do. And then you and I in clinic get that full report of being able to see, okay, well here, I mean, it's really an initial assessment like you and I do with a deeper dive into some of the lifestyle habits, a summary of what they're doing, and then also getting to see first and foremost, okay, well, what is it that you want to achieve, right? So they're already coming in level set, and then that 90-minute appointment that you spend, that you now like are diving into and probably having some more fun with, you actually can dive super deep. You end up as the healthcare provider walking away feeling so much more satisfied because you're actually getting to do what you are passionate about, which is helping the patient move along their journey. And then the patient walks away with you feeling more confident that you, their doctor, who they've built this relationship with, like you actually care and that you actually understand them and that you're able to actually help support them. And so it's a combination of things that have to happen in order for us to be successful in improving those outcomes.
This show is brought to you by Cherry Health, Canada's medical network where healthcare practitioners connect. Physicians, pharmacists, nurses, chiropractors, and all other healthcare professionals can sign up for free, start connecting, messaging with colleagues, or checking out job opportunities posted by thousands of employers across Canada. With dozens of healthcare-specific job filters and search options, we make it easy to advance your career, find your dream job, or line up your next locum with hundreds of new jobs posted every week. www.cherry.health to get connected today. How much did the psychology degree weigh into kind of formalizing and defining these processes? I imagine that probably played a fairly big role just in terms of how do you concoct such a system that's effective?
So I was telling the story the other day. I remember the first semester of that psychology degree after I did my BSc. And I said to my fiance at the time, I'm gonna fail. I'm going to epically fail because switching like the way that it trained my brain to think, the psychology degree versus a Bachelor of Science degree on strict like science, if then decision trees and stuff. And I was lost. And so I would say that the psychology degree has armed me with an amazing opportunity to be able to shift my thinking and get out of that siloed box that I was in with just the science degree and recognize that there are different perspectives that we have to look at and stuff and different ways to problem solve than just looking at, if we do measuring variables, like objective variables in science experiments, right? And so it was transformational. Hands down.
There was I can't remember the fellow's name, but I took one of his CBT courses, Greg Dubourg through CBT Canada. But he referred to it very eloquently as subgluteal thermogenesis, the art of lighting fires under butts to do whatever the behavioral output was. I thought that was a really nice way of framing it.
Very much. I think I would say that the most influential person in my clinical career has been Dr. Albert Bandura, who's now passed away, but he actually was a psychologist that was born and raised in Alberta, in rural Alberta. And he spent his entire career working at Stanford. Back in the 1970s, he did some interesting research, but the one that has been influential in my career has been his sociocognitive theory of self-regulation that he coined. And what he proved is that, and it's at the heart of what we've built into MyViva plan, is he proved that we as humans, if we collect some objective data about how we're feeling and how we're behaving, we naturally will start to process the connections between all of that data, and we will use those learnings to determine what direction we want to go next. And so that's where you and I as healthcare professionals, that's where we need the patient to be. And what's interesting is you heard me say that I worked with the train wrecks within the system, people living with kidney disease, heart disease, diabetes, and another 10 to 12 different comorbidities. I mean, that's complex. If I could improve clinical outcomes with those individuals that are years into living with their chronic health conditions, it's possible for anybody. And that's what I proved. And so that's what gave me hope that that we could really transform how we are currently delivering patient care, uh, and how technology can help enable us to get there.
Maybe just for anybody who's not like, familiar with the company, could you give us a quick overview of just how the app works for the patients? Like once they get onboarded and once they get up to speed, how does the process flow for them?
So the process once they get onboarded and stuff it was always intended to work alongside their healthcare professionals. So you, their physician, me, a dietitian, if patients are working with a dietitian or any other discipline, it doesn't matter. We all as healthcare professionals need patients to do the self-care. And so the patient engages, we have built a whole bunch of different journeys for specific health conditions. And so we feed patients little nuggets of along their journey to say, okay, so you're on the high blood pressure journey. Well, we encourage you to do your daily reflections. So why do we encourage you to do that? Well, that's, as I was just describing to you, it helps build awareness. And so the awareness is where things first start, because once that awareness is built, they will decide what direction they want to go with respect to self-care. So some of them might want to work on sleep. Some of them might want to work on nutrition. Some might want to work on exercise, or some might want to just stay focused and work on the mental health. And so it guides the patient to do that. The system also takes the patient's information and it will build out. So when they're ready to dive into work on the nutrition, it automatically builds out all of their nutrition requirements, just as a dietitian would do within the clinic setting. Why have we chosen to do that? It is not intended to replace the dietitian. Our system is not intended to replace the healthcare professionals at all. It's actually to instead enhance. It's to take away the mundane stuff that you and I are stuck with doing. Like a dietitian, it takes me 2 to 3 hours to build a nutrition plan. And do you want to know what happens, Jordan, when I build them for patients? They come back the next time and go, oh, can you actually just tweak that? Because that's not quite right for me. And now it's winter. Can you actually tweak that? Or my doctor started me on these meds and it needs to be adjusted. Like it's forever being edited. And so I remember thinking, oh my gosh, I just need to teach people to do this themselves. And so that's what we did. We've automated the system that it constantly can be changed and updated for the patient and for their guidelines. Same on the fitness side of things. And so the patient goes on this journey that's really there to be that backup support for them, building self-efficacy at the same time of helping them manage their lifestyle, their lifestyle medicine care plan at home.
It was one of the things I found the most interesting too. Like before signing up to actually use the platform with my patients, I didn't realize there was so much in there in terms of personalization with the meal plans and so many different pieces around patient education. I thought it was going to be just this super nifty, engagement tool and, kind of like keeping the patient enthused in between visits. But there was a lot more that I did not realize initially.
Yeah, and thank you for recognizing that. It's complex, and yet what we've done is we've taken the complexity and made it look simple. But as like you said, when you get in there, you're like, oh, that has to be customized. So there's so many layers on how deep we actually went into customizing this technology to ensure that it can be as specific for the patient experience and for the health conditions that they're living with.
It's interesting just when you look at the nuts and bolts of it, of like these underlying pieces, how relevant it is across domains, and especially to like, I would say most things in primary care, right? Like on the one side, I'm doing mental health counseling. And then when I've got my other hat on, we're doing weight management. If you're in like, just standard primary care clinic, if you're working with a patient on their blood pressure, their cholesterol, any of these other types of things, their sugar levels, right? It like often comes back to those same kind of like root causes or those foundational habits that the patients either have or have not developed yet, and just like how universally applicable those become.
From people who have absolutely no chronic health conditions to people who are living with multiple health conditions, it hit me that there is a common denominator across that entire health continuum. And it's like you said, it's self-care, because what it comes down. And the other aha moment that I had is that patients, how many appointments on average do you see, or how many appointments in a year would you say you have with your average patient?
Depends on the setting, anywhere from 4 to 10, maybe.
Okay. And
or
how
in a
many?
more general practice, it'd probably be
Yep.
even less, like 1 or 2 on the
Right.
lighter side.
Right. And so even if it was 10, like how many minutes or how many hours for each of those appointments?
Well, then you're looking at, well, in my case, an hour and a half for some of those ones, but in a more
Okay.
standard setting, 15 minutes maybe.
Right. So when you add that all up, the average, even if patients were spending an hour a week within a clinic setting seeing a healthcare professional, 52 hours a year, that equates to less than 1% of time being spent in clinic. So you and I can be you can be the best doctor on this planet. I can be the best dietitian. At the end of the day, who cares? Who cares? Because we are not affecting change in the way it's an impossible ask for you and I to affect change with that amount of interaction with patients. It's impossible. So if we accept that, and then remember I said that the self-care is the common denominator, that's where the aha moment came to being, well, we got to take what's in our brains, come up with a system that we hand over to the patient to get them engaging with, and they become that partner in care alongside the journey with you and I.
How do you use the tool in your own practice? Like how do you typically employ the MyViva plan?
So my typical way of doing it is, because even before I had the technology for 20, and this again going back to the psychology degree, I've used the reflections regularly. So I would get patients to collect some objective data for me for 7 days, not just about food, but it was about how they were feeling and some different components, and then come back and see me in 7 days. And that got them focused on understanding what their world looked like. So with the technology, what I do is get them to actually go in, do the initial assessment, which takes about the same time that it would if they came to see us in clinic, and then say to them, okay, you're going to do a mental health assessment that's going to show you where stress is showing up in your life. Because a lot of times people have zero clue. They just say, how many times have you heard, oh, I'm stressed? Like, what are you and I supposed to do with that? What does that mean clinically? I'm stressed, right?
Let's teasing that apart, right? Where does stress end? Where does anxiety start? Where does burnout factor in? Yeah, exactly.
Yeah. Because stress for you might not, it might not affect your sleep. But for me, I wake up at 2:30 in the morning and I'm up for the rest of the night. Like, we're all different in how stress shows up, right? So just like saying stress, it's kind of like, so what? So we actually have integrated this assessment that was built by psychologists in California, and I've used it for 15 years. It's awesome. It is in depth, 100%. It asks questions that people probably haven't even thought of, and it looks at how stress shows up physically, mentally, and in our self-care, all of that kind of stuff. So they do that and they get an understanding. And then I say to them, just do your daily reflections. I know you want the 50 pounds that you want to lose. I know you want it gone as of yesterday. I get that, and I'm here to help support you. But here's the harsh reality. We need to level set what's going on and understand all of the variables that are going on before we are ever going to figure out what the right direction is and where to start. Because I'm all about helping build sustainable habits for sustainable outcomes. So just jumping in and saying, yeah, go do that fad diet, or let's just dive in and do exactly what you want right now. There's never been a time when I've asked patients who are emotionally charged when they come in to see me to do that for a week that don't come back and say to me a week later, holy crap, I came in here a week ago and told you I wanted to do this. Today, I can tell you that's the last thing I want to do. We can't start there. That would be, I would fail instantly. Here's what I've learned in the last week. This is what I need your help with, Loreen. It is a massive game changer, massive. And then we start from there, and it's every appointment is different. It follow the journey or follow the direction that the patient wants to go. But even the ones that weren't at the beginning engaged or didn't necessarily think they were engaged in making any changes, they find something they want to work on. And then then using the program, say, okay, so you want to actually dive in now and start focusing on nutrition. Okay, so you as a doctor, you might not have access to dietitians. People that live in rural areas might not have access to dietitians. But I am a dietitian, and I will say to the patient, all right, what I want you to do for homework now is, you decided you want to work on breakfast? Okay, for your homework for the next week is build 5 breakfasts within the system. Start eating those breakfasts, do your reflections, your daily reflections, and come back in 2 weeks. And then let's have a conversation about how that's going, right? So we take it bite-sized pieces, but we give them some homework, they engage. And then when they come back, it's tell me how it went. What were some successes? What were some struggles? Where do you want to go next? And we just keep building upon it, brick by brick.
It's such an important point, I guess, that initial level setting, right? Of like, okay, person's only got so much time, resources, energy, money, etc., to put into something or another thing. And like, your priority as the clinician might not always be their priority. And so just taking that initial opportunity to kind of like have the patient look at the bigger picture of like, okay, what are, flip all the stones over, get all the cards on the table of, what are all my options here? And what is actually my priority? Where do I want to put my limited amount of resources? Because like you mentioned, right, it's like, sometimes it seems superficially like a good idea, like I want to do that. But then often after a little bit of like further thought, they're like, that's not even close to the top of my priority list. We got to start somewhere else with X, Y, or Z.
Exactly. And the other reason why we built it the way that we did is that it's to enable you and I in the care that we provide. One of the most important relationships that an individual can have is the relationship with their physician. That's still what the data shows. They might be fortunate to get to work with a dietitian if there are some in their area, and right. But let's face it, like that is a limited resource, just like a lot of allied healthcare professionals. But even if there are, like us in Plentiful, there aren't us in Plentiful that we will never be able to spend, all of us, 90 minutes on it. Like you said, you're seeing patients for maybe 10 times out of the year at max. That's still a limited amount of time. And so that relationship that they have with the doctor, with their healthcare professionals, that we want to keep the patient within their community of care, to build that relationship with you, because it matters. And so we don't want to take the patient out and send them to see other healthcare professionals that then end up doing the same thing, and you lose them to follow up. You're scratching your head going, hey, wait a second, I haven't seen so-and-so for 6 months. Where did they go? They're no longer here, right? How does that actually help the whole ecosystem work effectively and ensure that there's that continuity of care with patients? And so that's the other big bonus and intention with our technology.
The other thing that I think is really impactful is that the technology kind of puts it into the patient's hands for how to make those brief and infrequent interactions with their physician or their other healthcare provider that much more meaningful, right? Because like, you got to talk about the weather for a minute. That's mandatory. You got to like have
Yes.
some little bit of like chit chat, just normal human convention, right? And then, at that point, okay, now we've got 12 minutes in a more typical family medicine context, right? And so the people that tend to like show up with an agenda, like they've clearly got like, okay, this, and this on my mind. Or if they come to their counseling appointment, they're like, man, I gotta like, this has been bugging me. This has been bugging me. Or if it's, their weight management or their whatever else is going on, the people
Mm-hmm.
that like show up and they're able to kind of like get what they want out of you, the provider. So that kind of tool, putting that back in their hands of not just kind of showing up empty handed, like, okay, something's got to change, but kind of like, what direction do they want to go with things? I think then really helps make that relationship development that much more powerful, because it seems directed and like poignant from what they actually want to get out of it, as opposed to like prescriptive and dogmatic from the doctor or whatever he or she said.
Mm-hmm. Percent. And I mean, that if we just look at the stats with medications, I mean, medications absolutely have a place and a role to play, hands down. But the stats on meds are 50% of prescriptions, I think it is, are filled, and 20% are followed. Percentage
Is that
of
bad? Man.
Yeah, yeah. So, I mean, you and I can prescribe whatever it is that we want with respect to lifestyle medicine, or whatever it is that we're recommending. If the patient doesn't understand it and doesn't understand the why behind it, isn't bought into it, we're not getting anywhere. And I mean, and I think that has become very evident when you look at the prevalence of all of these chronic health conditions, that like there isn't a single country on this globe that isn't plagued. Non-communicable diseases are prevalent in every country around the world. Doesn't matter what their healthcare system is, who's paying for what or whatever. Non-communicable diseases have overtaken communicable diseases, right? That episodic care. And so I heard a couple of weeks ago, somebody said, we're living longer, but we're not living healthier. And that we get one kick at this can. Like we all get one. Our life is our life, and it is finite on this earth. And for me, I just want to help people live both mentally and physically as optimally as possible. And for you and I as healthcare professionals to be inspired and to have a passionate career where we feel fulfilled and satisfied that we're making a difference. And I think that we can do that, and the technology can help us.
Is the average healthcare provider equipped to cover all these things? Like, do they in general have the tools in their toolbox to have all these conversations and, get those points across in a convincing manner?
Yeah. So I think they're having the conversations already. And the reality is we want to be able to equip them with the confidence. So we want to equip them with a system that has everything, and the confidence that they don't have to know it all. So how we use it is, and how I use it in my practice, because I'm not the mental health therapist and nor am I the fitness expert, but we will say the system. So, okay, you want to focus on fitness now. All right, well, within the system, here is what you can go do. Go dig into this. Go set up your 6-week fitness plan. That's about all you and I need to know. Go set it up. If you actually want some help with that, you tore your ACL, I would encourage you to go book an appointment to see a physiotherapist, get them, open up the program, get them to help build out your fitness plan on the system. And then I want to see you again in 6 weeks, right? So you and I don't have to expend and feel like we have to actually say anything more than just guiding them to the program and describe in very short detail, 1 or 2 sentences, what you want them to dive into and explore, and then follow up with you the next time, or reach out to that expertise if that's within their ecosystem, if it's available. And if not, they can come back. You can still work with them on the fitness side of things, with them just giving them the encouragement to say, hey, how'd it go? Right? What were your struggles and stuff? Oh, everything went well. Great. Then keep up. Awesome. Like keep doing that. And let's continue to have the conversation. Right? So you can see how it allows us to trust that everything within the system is evidence-based and clinically validated, and it's there. And so I don't have to go anymore and look on Google to say, oh, what did you actually say? Oh, you want me to actually learn about that? Oh, no, just if you want to know what foods have tryptophan in it, go to Vivapedia and it'll tell you.
It's nice that it sort of is that all in one, I guess, like your one-stop shop for all the different lifestyle medicine pieces, right? Because that's a big part of, I think, where patients struggle is just like accessing trusted resources. Like out of, I think all of my patients that I deal with, like a huge, yeah, definitely a majority, probably an overwhelming majority, really struggle with finances. And so when it comes to something like, getting in touch with a counselor, with a dietitian, with a physiotherapist, with an exercise specialist, like that's often just like the conversation's a non-starter. It's just not viable. And that's where things kind of just peter out. They're like, okay, well, that's a dead end. There's nothing I can do there. But now you've got a way to actually give them access to these types of information.
100%. And here is what I have learned. There is, even if people have the bandwidth financially to be able to afford all of these healthcare professionals, most of them don't want to see 20 different healthcare professionals. Let's face it, they don't. But that's a small percentage of people who have the bandwidth, right? So they have the resources that they can pay for it. They're choosing not to. And I've asked them why. Because it's information overload. It's too much. There's conflicting information, da, 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 da. But more often than not, you have people who will say they have the relationship. They had to work with a dietitian because of some health conditions. They have a really good relationship with that dietitian. That's all they can afford. And as much as, yes, they would want to go see a trainer, a physio, a mental health therapist, their doctor and their dietitian, are all they have time for. So then how are you and I, when we don't have that expertise in those other fields, supposed to support them? Well, guess what? We don't have to worry anymore, right? Because now there's this system. So it isn't, like I said, it isn't to replace any of us, but it's the reality is people who are working full time don't have time to spend coming to see 20 different healthcare professionals. And I get that team-based care is important, and I get I value that, but patients are burnt out. Like, I mean, come on, like we've got to figure out how to do this differently, where we limit the amount of different conversations that the patient is having and yet get the maximum output of the support.
That's true. It is like draining dealing with me and probably you, I would imagine, in a professional context. The patients just are like, man, this is a lot to try and absorb. And then like all the homework that comes away from it afterwards. And then when you layer in a couple other different providers of different disciplines, like it becomes overwhelming. And yeah, definitely you see it all the time as well. Like patient has the benefits through their work plan for X, Y, and Z, but they're like, I just don't know if I have time to even tap into these resources.
Well, and even if they do have time, those healthcare professionals that they tap into their benefit plan, how many of them are calling you to relay what they did with the patient? They're not. So again, it's back to the siloed care, right? And so it becomes this, it's just this frustrating ecosystem, and to have that common, I don't know, common isn't the right word, to have the ability to be able to enhance. So now with our technology, if your patient, if patient A has the best relationship with you, you become that primary coach. Patient B might not have the best relationship with you. They might have the best relationship with me. I become that primary coach. But you and I can actually chat together or whatever, but they'll come see me more often and you less often, and vice versa, right? And to me, that helps reduce redundancy in the system. It helps improve efficiency for you and I. And you and I both know, I mean, the 90-minute appointments that you talked about having with patients, you actually get to have a richer conversation. You actually get to dig in and move them along. And like, that's just way more satisfying. And at the end, it's that win-win-win that I talked about. Win for you, win for the patient, and win for the system, because we're providing better care and improving outcomes.
What about zooming out to like the systems level perspective? You've been at this for a few years now. What have you learned about just kind of the broader healthcare system and how these digital tools fit into that ecosystem?
Well, oh, that's a loaded question. So the digital health programs do fit. The problem is within Canada, we're lagging behind, significantly lagging behind, which frustrates me as I guess an entrepreneur and a thought leader, innovator. We're, I think, a decade behind the US in how we've looked at integrating technologies into the healthcare system. We are also a lot more risk adverse in Canada, where it's like, oh no, status quo, okay. I think, so those are two things that I definitely can see. But then the third one that drives me, that probably frustrates me the most, is that there is this mindset, this thought process that is far too rampant within Canada, within healthcare professionals, that how we are currently delivering care is optimal, and that we sit there and will say, well, okay, digital health company, prove to me that you prove your outcomes. And then I flip that on its head as the healthcare professional and say, well, okay, clinic A, show me your outcomes. And that's when they sit back and go, oh, well, we don't evaluate any of our health outcomes. Patients go and so there's this, we do a dismal job of evaluating outcomes in this country. We do. Value-based care has definitely been a topic of conversation and caught on within the US, and they're doing way better than us on that. But how many evaluations, what's the ROI on most clinics? We don't measure that within Canada. We don't measure that within all the different disciplines and all the different specialty areas and stuff. Have you seen that research?
It would be very interesting, because this is, I don't know, one of the things that, I don't know, I kind of struggle with sometimes is just how much impact is happening, right? You have a day of patients. Some days all the patients are losing weight. Some days all the patients' depression is getting better. Some days it's the opposite of that, and you need to start sending out some Form 1s and patients having to go to the hospital. And it's just it would be very interesting to see that as more of the conversation of just how much impact is actually occurring across the board. Because it's easy to get into the silo of just I don't know if I want to look under the rug.
Mm-hmm. Well, and I think we have that mindset. We don't want to look under the rug, because full-on clinics, day after day, they're you're seeing many, many patients, right? It's just, you're putting out fires, you're dealing with that acuity of the situations, and you're passionate about what you're wanting to do. So who's thinking about evaluating on a day-to-day basis what it is that we're doing? And let's face it, EMRs, I think we all can say that they take a little bit more time than what I think they originally were sold to us, to believe that they were going to help drive efficiency for us. And that, I don't think, there's certainly getting better, but I don't think at the beginning, we've definitely come through a lot of years of using clunky technology, which has also soured a lot of healthcare professionals' experience, right? It's that was given to us with the intent of driving efficiency, and it's done the opposite. So no thanks. It doesn't even matter what the technology is, right? So that's a harsh reality that we need to face, which brings me to this whole frustration that I have right now, is saying, okay, so if digital health is going to, I do believe it's here to stay. And I do believe there are many digital health programs that can help drive efficiency, reduce redundancy, and improve outcomes. But there is a big but there, because it has to be digital solutions that are built with intentions, that are intentionally built with purpose, and that are thoughtful. Not just, I've got a free weekend in my mom's basement, I'm actually just going to, whip up a digital health app that's actually going to do this one thing. And I'm going to be a bazillionaire and I'm going to go sell it to the system, right? That siloed approach to healthcare and building those technologies is the very thing, is one of the very things that is impacting the progression and the willingness to engage more and more with digital health, because we've done it in silos and we've built the technologies and we've deployed them without ensuring that they seamlessly fit into the workflow for the healthcare professionals. And those are our biggest mistakes. And if we don't fix that, then those of us in the digital health space who have done it, built technology, spent years building the technologies with thought, intention, and purpose, and that are clinically validated and stuff, there's going to constantly be that struggle to integrate in the system. That's my 2 cents.
It seems to be going the right direction. I don't know. Recently, I've been very enthused with my AI scribe tools lately. They seem to be helping a lot with the just the efficiency of charting and documenting and being able to pay attention to the patient more versus having to focus on your medical legal, notation of everything. Actually, to your point about the, just how do we measure the outcomes and things? Hopefully that'll be where the MyViva program gets me to, of just being able to look and track patients' outcomes over time, of making that easier and more streamlined to get that data as to whether things are going well or not well. Because it's I don't know, all these different lifestyle medicine pieces, they wax, they wane, the blood sugars go up, the blood sugars go down, the weight goes up, the weight goes down, the mental health gets more depressed, it gets less depressed. And so it's kind of how do you actually pin that down as to whether or not this has been a successful patient management, over this last year. So maybe that'll actually be a really interesting way to start, just patient does their own data input every day with their reflections and their journaling as to how things are going. Make it a little bit easier to understand as the provider without having to walk through a PHQ-9 questionnaire at every visit, which would take up the whole visit, without having to go through all these different things. So that'll be actually quite interesting to see how those numbers evolve over time. And I'm kind of excited just at having this data accessible now.
Yes, and you're right. And I think there's something that you said there that needs to be highlighted. Chronic disease management is a hot mess. It's a hot mess. And for you and I, to your point, there's a bazillion data points that you and I are thrown at. And how do we take that and build, first synthesize it, pull it all together, synthesize it, and come up with just here's the story, right? A, B, C, D, and here's what we're going to do about it. And that's what the system is intended to do, is to cut through the chaos and give you context to all of that, and be able to help you navigate, okay, so in your role as the physician, in my role as the dietitian, here is what I can lean in and help you with on that front. And I think with what we're really excited about, because we've integrated, we started building an augmented reality avatar 4 years ago, and talk about thought, intent, and purpose. AI has to be, just like with these scribe companies, finding the right one that's actually done the due diligence on the privacy security side of things is important. But then clinically, also critical. So we have been clinically validating our augmented reality avatar for the last 4 years and training it on multiple different chronic disease states. And so our intention with the avatar is to, within a closed environment, take that data that the patient is actually inputting and the data from all of, the labs and things like that, and to provide some semantic interoperability with that, and also the AI to look at patterns and stuff to say, okay, Jordan, did you know that when you actually don't do your workout throughout the week, you consistently record and comment that your energy level is low? And when your energy level is low, did you realize that you're actually driving through the fast food drive-throughs for dinner every night after clinic? And then you are also not able to sleep because you are saying that you have significant heartburn. Do you see the connection, Jordan? Right? And so helping patients not only hold them accountable, that's how we're gamifying our system with the avatar, but to be that accountability buddy for self-care, and to show them those patterns of those self-care behaviors that they can actually understand, but it based on their experience, right?
Some people are better than others at connecting those dots and realizing these patterns. A lot of people I find are kind of oblivious to it, right? And I don't know if you can speak much to this, but right now, how much health literacy is going into the education system? How many people come out graduating high school with a basic understanding that, okay, if I go for a run in the mornings, I will feel more mentally sane throughout the week. If I eat less sugar, my energy levels will be good. And even just having kind of the foresight to be looking for those patterns in their life over time.
Oh, we don't. So that's the interesting thing. Health literacy and connecting those dots. Personally, from what I've seen in the research studies that we've done with first-year university students, being involved with education of high school students, having two teenagers that have turned to young adults, 19 and 21 lately. Yeah, there's a significant lack of health literacy. And I've really, one of the research studies that I did when my kids were in elementary school is I had interns come to the school, and I said to them, okay, I want to show you how poor, and granted, I'm not, so I'm going to actually, I'm going to have an opinion about the food guide, because sorry, I am as a dietitian, because the old one that we used to have, what I proved is that it actually did not teach application. And so with the interns at the elementary school, I said it was a K to 6. And I said, okay, go around and do presentations and teach the Canada Food Guide and measure knowledge on the Canada Food Guide. Okay, so they did that. 100% across the board. Every student from K to 6, they had that food guide memorized. 4 weeks later, same classes, I said, now you're actually going to go measure application. So you're going to go and you're going to actually get the students to build, using the food guide, to build you some balanced meals. 0, Jordan, 0% across the board from K to 6. And I did that for 3 years in a row with several different students that came through. And these students in nutrition were dumbfounded at what they found, because they were, that's what we're taught as dietitians, use the Canada Food Guide. I'm not bashing the food guide. I'm questioning our approach and how we deliver. So knowledge acquisition is one thing, but if we do not build systems that teach application, it ends up being a useless tool. So we have to your point, we have to find systems that we can evaluate application and understanding in ways that in dynamic ways that allow different ways for patients to be able to engage kinesthetically, auditory, or visual learning.
And what would that look like if you were in charge of the education system? What would they actually need to build in for the average students to start learning to apply that knowledge?
Well, this is where the technologies come into play. And that's exactly, it's the kinesthetic learning. And so lots of schools, absolutely, that's what they do, right? That's why we have science labs and stuff. But think about, you're younger than me. And I was in university, 30 years ago. And even back then, biochemistry labs started to disappear, right? Physiology labs disappeared. Became less and less labs on that kinesthetic learning. And it just became about reading and memorizing information and doing multiple choice exams. Well, multiple choice exams don't really, that's been proven decades ago that that's a terrible way to measure knowledge acquisition, right? But we do it because of the volume of students that we have. So I think all across all of our different systems, we need to start looking at the knowledge that we already have that's decades old, which is all I've done. I mean, everybody looks at MyViva plan and goes, oh, wow, you built this amazing thing. I've taken the brilliant research findings from very brilliant people over the decades, and I've put it all together into under one umbrella and synthesized it in a way to help do exactly that, to actually help empower people and build that self-efficacy. And so I think that the technologies and that the ability, the sandbox, the living labs, like to be able to get people to have those opportunities to play, like in the kitchen, right? Teach people how to cook. I mean, take them to the grocery store. I was shocked about 5 years ago. I went to go buy some groceries, and the young girl, she was about 16 at the till, held up broccoli and asked me what it was.
What is this foreign substance?
Broccoli, right?
I guess, yeah, you could have, it's interesting, like just having the tool now, like the digital application layer to then use that knowledge, right? Because I'm just thinking, like, I've taken a million math classes, but if I don't have the calculator, I'm not going to practically be able to do any, like, everyday arithmetic without having something. So maybe that's like what's really been lacking is, okay, you can sit there and make a meal plan, you know the food guide, but like being able to practically do so and put that into practice, it's still like a dietitian. It's going to take 2 or 3 hours and a 4-year degree to be able to do that for a person. Like, is the average person without some extra, compute power behind them reasonably going to be expected to like be putting together healthy meal plans all the time?
And they will with our system. That's the beautiful thing about it. And so we've taken that and we've helped teach that application side of it. And we just actually interviewed, so we don't typically, I mean, we're not allowed as regulated healthcare professionals to have testimonials, but this mom reached out to me a few months ago, and she said to me, look, my 6-year-old son just got diagnosed with type 1 diabetes. Can he use your program? And I said, actually, it's not built for kids under the age of 15. And I said, but you can. And so do you want to get on a call and I will walk you through how to use it? So we got her set up on it. One of our dietitians went in and adjusted the calories to be specific for, or adjusted the back end to be specific for her son. So the nutrition, like the template that it has in there, she can now use it to build meals for her son. And then once she gets confident with it, she can actually get her son engaged in building these meals in her program. So what she said to me is, well, the system only gave me, she said, I had yellow sticky notes all over the walls in our kitchen trying to figure this out. And your system actually gave me the how to do it. Right. And so my confidence level has gone through the roof. So do we nerd out and tell the patients or tell the users all of the back end algorithms and stuff? No, they don't need to know that. They just need to know how to execute. Okay, so I need to pick so many servings out of each of these groups, and all of the foods that are listed in these groups actually will fit in here. Okay. Oh, and then it'll tell me how much of the portion size to have. Oh, that's a no-brainer. Right? So it's taking the complex and making it simple so that you or the user has confidence in whatever situation that they're in, that they can navigate.
Giving them the tools to succeed, I guess. That's the key.
Exactly. Yes,
Very
exactly.
Cool.
Yeah.
Well, anyways, we're over time here. I hear your alarm going off in the background. I'll let you get out of here. Thank you so much for joining me today. Loreen Wales from MyViva Plan. Any final comments, shout outs?
No, just thank you for having me, Jordan. I'm excited to have you using MyViva plan in your practice to help support all of your patients. I mean, I know you're focused on obesity medicine, but I think, as I'm sure, once you get into it, you're going to see that it can help support many other chronic health conditions. So yeah, I'm happy to have you as a part of the MyViva community.
Okay, I'll keep you posted how it goes. I know my two nurses were pretty excited to get going with it after the intro, so I'll keep you posted.
Thank you.
Okay, thank you so much for joining me today. Have a good one. Thank you for joining us this week on Leaders in Healthcare. If you enjoyed this episode, please like, subscribe, or leave a comment. And if you found this episode helpful, don't forget to share it with your network.